this computer. Okay, we're going. Hi, everyone. I'm Kevin Knight. I'm a VP of Marketing at Vida Health, and I'm here with Stephanie Tilenius, our CEO and founder. And we couldn't be more excited about being here, part of this conference. I think that the theme of how to survive and thrive in a new normal beyond COVID-19 is such an important topic. And under the umbrella of going digital within behavioral health, it's just such an important thing for us to be talking about. And it is amazing. Stephanie and I were just talking recently about how much has changed in just the last couple of months, both to our business and the world around us, and of course to the way that we treat people with behavioral and mental health challenges. So let me just dive right in here. We'll start right at the very beginning, Stephanie. You've spent a lot of time in Silicon Valley, kind of come from a strong tech background and product background. You were at eBay and PayPal and Google, and it was while you were at Google that you decided to found Vida. Tell us about that. What led you to that, and what convinced you to walk away from such an exciting career as an executive at Google to do this?
Well, my father had multiple chronic conditions, and he'd been struggling for a while, but it got worse. And late 2000s, it got worse. He had diabetes, obesity, CHF, COPD, and depression. And I was just watching him struggle, and I kept thinking there needed to be a mobile virtual care solution for him. He had a lot of different doctors that he was going to see in person, but the recommendations were conflicting, and no one was really watching his whole health or the integration of his meds or his lifestyle or behavioral issues. They would just prescribe medication as opposed to like really trying to solve the root cause. And you could see that the depression was, it was making the obesity and the diabetes worse and vice versa. And I was really looking for a continuous care model that really met him where he was at and enabled him to succeed and make small changes to really tackle these conditions, because they were really lifestyle driven. And there was really nothing out there in the market. And everything that I used in my life, everything, I was working on payments and shopping, but everything was automated. It was all on your mobile phone. It was all easy, instant access. And I thought, why doesn't this exist in healthcare? It doesn't make sense.
When you say continuous care, can you elaborate on what you mean by that?
Well, when you have a chronic physical or mental health condition, you spend some time every day managing that condition. The statistics that I've seen are, on average, people are spending something like 5,000 hours a year managing their condition.
Wow.
And, every day you're having to think about how you're living your life to manage that condition so that the symptoms don't rear. And so you can function and be healthy and happy. And there was no continuous care model that's like a day-to-day connection point to a human that keeps you accountable, or a set of devices or metrics that help you really realize how you're doing, how your blood glucose or your nutrition or your thoughts for depression were faring every day, and how they're influencing your life and your behaviors. And there really was no continuous care model. The typical approach was you went to the doctor, you saw them infrequently, they would prescribe medications at times. There really was no underlying day-to-day management of your own data. You're looking at your sleep, looking at your stress levels, looking at your nutrition, your exercise. All these things affect your mood, your blood glucose levels, and they are all interrelated, and there was no such continuous care model.
Yeah, interesting. It's sometimes when people ask me what Vida Health is, the way I describe it is, people are always going to the doctor, and the doctor's saying, if you don't make some changes to your lifestyle, we're going to have a real problem here. And then it's like, how are people supposed to make those changes? It would be like bringing a bazooka to a knife fight sometimes, to have a doctor, like a cardiologist, helping somebody watch their diet or exercise a little bit more. And yet we need constant accountability, nurturing, guidance. I mean, there's so much information out there. The 5,000 hours you talked about, I mean, it's just insane. Was it 5,000 or 500 hours?
You spend a little bit of time. You think about it. If you have a chronic condition, you spend time every day really managing it. So.
Yeah. From the medication to the blood pressure readings to the blood sugar reading.
Right. You've got to prick your finger. You've got to make sure your glucose is in line. If you're out of range with your blood pressure, you're checking that, or you might not feel well. If you use a CPAP to sleep at night,
Oh yeah.
it may impact your sleep during the day, and then you may not feel well. You're looking at, you have to watch your nutrition. You have to think about exercise. These are all really important components. And now people increasingly are using meditation, which I think is really important. And, we have meditation embedded throughout many of our digital healthcare programs. So, I think the proactive nature of all these opportunities to just self-care during the day to make sure your statistics are in line with your condition is really vital to maintaining your health and avoiding flare-ups, avoiding going to the doctor, going to the ER. You really shouldn't have to do that.
Yeah. I was just about to ask you, and this is a good segue into it. This is a conference about behavioral health, going digital, and how things are changing in a COVID world that we think are going to stick in a post-COVID world. And we've spent a lot of time talking about chronic conditions. And I think that's a really interesting point that I'm not sure the healthcare system on the whole has really acknowledged and certainly hasn't organized itself to address. But we're fond of a saying at Vida that every chronic condition is a behavioral health condition. Can you elaborate on that?
Absolutely. So we serve individuals that have multiple conditions. If you look in the United States, 60% of people have a chronic condition, 40% have two or more. And then individuals who are living with diabetes and depression have a much more complicated process for managing their conditions. It's harder, right? And they cost more in the system too. They're about 4 to 6 times more expensive for health plans, employers, et cetera. And because of my father's situation, and I just saw, like, we're all humans, right? And we have multiple different issues going on in our lives, and especially right now, everything is exacerbated because of the situation with COVID and the unrest in our country. And so it's very hard to treat the diabetes without treating the depression. We had a situation where we started with cardiometabolic syndrome when we founded the company, and we launched, and literally 30%, 40% of our customers had co-occurring chronic depression. And we realized that a lot of the underlying root drivers of diabetes are related to a behavioral health condition like stress, depression, or anxiety. And that if you don't treat the root drivers, you won't get, you won't get the results you need. And many people, it's very hard for them to know whether the diabetes is causing the depression or the depression is causing the diabetes. And sometimes they're interchangeable for a while. And so we realized that we had to treat the whole person, and we had to be able to give them, not only the advice around diabetes, but for depression and anxiety and other behavioral health, mental health conditions. And so we added therapy to our network in 2017, and we started treating mental health conditions. And we realized that this was a vital part of healthcare. We also started seeing that most of our employers were struggling with this. Employers and payers as customers were struggling with this with their employees and members. And now in this time, the data is remarkable. So when we get an eligibility file, and individuals will be assessed as having let's say depression or anxiety. When they come in to us, the data will say about 20% have depression and 18% have anxiety. But when we administer the PHQ and the GAD and we start to work with them, it's actually today, and I think it's exacerbated because of COVID, but it is about 60 to 70% that have diabetes or depression. So that have depression or anxiety. So it is much more, much higher than we had originally anticipated. And it's much higher than what is in the eligibility files that we've received.
And that's just clinical level anxiety and depression. There's all of the stuff that is percolating below the clinical surface, like stress. And I think what's happened during COVID-19 is a lot of those people that had been able to keep their subclinical anxiety and depression or their stress in check all of a sudden the world gets turned upside down. It is such a stressful environment right now. And then you see everyone perkle up, and it's going to be fascinating, if not tragic, to see what effect that has on society as a whole when the chronic conditions lag those mental health conditions that you've just mentioned. Because if before there was such an overlap of morbidity, goodness gracious, did I say that right?
Comorbidities.
There we go. If there's such an overlap of that word, for the last 5 years, how much more is that chronic the chronic health problems going to grow post COVID? Because we as a society and as a healthcare system have not orchestrated things in such a way that we do a good job of treating behavioral health conditions. And so I wanted to ask you, Stephanie, there's so many remnants of our institutions that are just they're there because there was a purpose for them back when we had less information or the world looked different and things like that. And I think there's certainly remnants of our healthcare system that are catered to times well past. If you could wave a magic wand and kind of disassemble and reassemble our healthcare system to be able to fix America's healthcare woes. We know that we are just insanely high on diabetes and heart health and heart disease and all these other chronic problems that are just plaguing our quality of life, our cost of living, our cost of care. What do you think we need to do?
Well, COVID is an accelerant, so everything's moved virtual, and it's about time, right? I mean, we're seeing a decade leapfrog right now, and people are actually really comfortable with virtual therapy, with virtual care. Telemedicine is growing like, rapid fire, that you've never seen this level of growth in the last decade. And it should have happened, right? Because when you just look at our system, I mean, it's dreadful. It's so expensive. And it's not fair to individuals. We spend 90% of that $3.7 trillion on healthcare on chronic disease. But most of that is reactive. And it's after the fact. It's after already you've been on medication, you already have the condition, you're in the ER. I mean, look at the statistics that for just right now that we're experiencing. So the CDC has said that 78% of people admitted to an ICU for COVID have an underlying chronic condition. 90% of people who've passed from it had an underlying chronic condition. And then, 70% of employees are saying they have a mental health, either subclinical or clinical condition. So right now, we just need to be able to turn on virtual care to help people. And we're spending so much money in hospitals and they're all overwhelmed with people, right?
Yeah.
We don't have. So I'm excited because I'm seeing everyone turn on virtual care. There is no choice at this point. So it's really a shift in our societal approach to healthcare. But think about it this way. If you were to just reimagine healthcare, and instead of, let's say you joined an insurance company, instead of getting an OBGYN and a PCP and a heart doctor and all these, a therapist, all these different providers. I mean, at some point you may need them, but like if you just joined a health provider and they said, we're going to give you an individual that's going to meet you where you're at, understand all your data, understand all your family history, really evaluate what's best for you. And we're going to provide a continuous virtual care model. So virtual first. We really need to take that approach in our country. We spend far too much money on the back end of chronic disease, but we really should be spending it up front to help people avoid getting chronic conditions and really proactively managing their health with a virtual continuous care model. And it's really simple. It's really easy. It fits into people's lives in a much better, it's so much easier. You just use your phone at your own convenience when it really works in your life. It's fundamentally, I mean, everything else is online, right? We buy our groceries, we buy all our products. Why not do our healthcare online? Doesn't make sense, right?
It's almost like an ounce of prevention is worth a pound of cure.
Yes, that has been said many times.
I seem to recall hearing that at some point. So what I'm hearing is America has a lot of behavioral health challenges. and this is not new insight to anybody. We all know that we're more stressed out. We don't rank terribly high on the happiest countries in the world. We rank high on stress. We have high rates of depression and anxiety. We have high rates of stigma that prevent a lot of people from getting the care that they need. It's hard to get care through brick and mortar. We're all familiar with that data. And then what happens is that the untreated underlying mental health conditions contribute to exacerbate or cause physical health conditions like diabetes and heart disease and so on. And then we see an accelerant happen like COVID-19, and all of a sudden, because our nation is not physically well, it just spikes in our ICUs and we can't handle it, and we have to take these really drastic measures like we have during COVID-19 to try and protect our population who's not healthy. And at the root of this, if we peel back the onion, there's this mental health care that you're talking about. You just talked a lot about virtual care. If you were able to reconstruct America's healthcare system, clearly at the core of it, you believe that virtual care should exist. One of the things that strikes me so much as I travel around the country is, and hear stories from people and our members all around the country, is how wildly different life is depending on where you are in this country. A huge percentage of our population cannot go to the grocery store and get fresh fish to get, omega-3 fatty acids. They can't get fresh vegetables. They can't, they don't have access to a variety of doctors where they live. It seems to me that virtual care could really be an equalizer, a democratization of healthcare in a way that we haven't seen. I mean, you think of all these people who make pilgrimages to New York City and Cleveland and Minnesota to get really, really good and the Bay Area treatment. A lot of people can't do that. What have you seen in terms of the ability of virtual care to be able to close that gap in provider availability to the country, to huge parts of our country?
Well, you covered a lot of this. I mean, we have 3 problems in the country around mental health. So we have a stigma issue, which is, I think, has been mitigated a bit. It's getting better, especially the millennial population is embracing therapy and understanding the needs to manage their day-to-day subclinical, so it doesn't become clinical. And I would say COVID is now every employer and payer we work with, they're coming to us to support their population. They realize that there's a huge mental health toll. So stigma, I think, is going away in part. Access is by far the bigger problem. It's really a struggle for people to get an appointment. It takes months. You might get a recommendation from your PCP or a friend of a list of 10 to 12 therapists, and you call each one of them and they literally have no appointments for months. And so we're opening up access and making it instant. So you can literally go on your phone and get access, and you can get an appointment within a week as opposed to months. And then the last one is cost. I mean, the cost has traditionally been prohibitive and a lot of health plans don't cover it. And right now we're working with a lot of employers and payers that are realizing that they really should provide this benefit, and they are covering the costs and providing it for free to their employee population. And you're seeing more and more. Medicare came out, CMS came out. Everyone's looking to support. They recognize that the underlying mental health condition of the country really impacts, as you're saying, the chronic disease, and then impacts the cost of care down the road, and ultimately increases the total cost of care for our country. So you're seeing people starting to cover this as a regular benefit.
Yeah. Why would you say so? This is a change, though, in attitudes in America, and there are certainly businesses who would look at this and say, "Why should I be covering mental health care for my employees?"
Well, I think smart employers realize that there's a productivity hit, right? So if someone is struggling, they're not going to be as productive at work, and it impacts not only their work but their teams and other people. So there is a real awareness now among most employers that this is 1 in 5 people now, 1 in 3 people in the U.S. are suffering from a mental health condition, and it's something that employers have to pay attention to. They're seeing it in their PM costs, right? And they recognize they have no choice but to handle this.
Yeah, and I think as you pointed out earlier, left untreated, even subclinical levels of depression, anxiety, and excessive stress will lead to chronic health conditions. And those, of course, because of the institutional healthcare system we have in this country, do often fall to the employer to pay for. And so there's a cost savings there as well. Mm-hmm. So I think that was a well synthesized assessment of how what the country needs to do. There's the stigma, the access to care, and the cost. I want to come back to the access of care, because it seems that from a very basic, you mentioned it can take months to get access to a therapist. In this country, we're so accustomed to solving things in the capitalistic way, right? It's supply and demand. And it seems like a very simple problem, right? Like mm-hmm. if it takes so long to get access to a therapist, why do we not just have more therapists? Or why do we have this supply and demand issue?
Well, I think what happens is individuals who are suffering get a recommendation from their PCP. They may try to get an appointment, and if they fail, they give up. It's because they're already suffering, right? It's already hard enough. And when they make that step to go get an appointment, it's really important that they are able to follow through on that right away. And oftentimes it's so hard they give up. And so the majority of people do not pursue it. The other problem we have is when people enter into therapy, there may not be a strong therapeutic alliance. And so the therapy itself, they may go to one session and then drop out. And it's really hard to measure outcomes in an offline therapy setting. And so what we're doing is we're bringing people in and we're combining the actual virtual therapy in the app where you're doing video, audio, text, audio, and video with a therapist, but we're combining it with a cognitive behavioral therapy program that has content and guidance and meditations and other things in it. And so it's really the combination of those two things that engages the user in a way that meets them right away, that helps them move forward with this condition. And it feels like we're meeting them right away. So there's instant access and they're progressing and they're making progress and we're measuring outcomes. I mean, so this is really, we're measuring the therapeutic alliance. We're making sure there's a good fit. If there's not a good fit, we can get them another therapist. We're measuring how they're progressing through the program. We're looking at the PHQ and GAD on a regular basis. And it's really important to be able to look at success metrics throughout the process and make sure it's working for the individual.
Yeah. That's really interesting. I want to come back, speaking of outcomes, come full circle. We began this conversation by talking about your dad and the health challenges that he was facing and the way that he was let down by the healthcare system. What are some happy stories? What have you seen from Vida members who maybe look like your dad? And tell us what you're hearing from them, what you're seeing. And
yeah, I love the Vida stories. When I have people ask me what's the best part about working at Vida, it's the users and what they've achieved. So one of my favorite stories is one of our employers is eBay, and there was a woman who worked in customer service and lost 80 pounds, stopped smoking, and then got promoted twice afterwards, and really changed the trajectory of her whole career and her life. There are some employees at Cisco, for example, that have told us their story where they were really struggling with mental health issues, and Vida really helped. And they saw a 50% reduction in depression in 4 to 5 months. There's individuals at Boeing, for example, like where they've come in and they've done both therapy and diabetes management, and they've lowered their A1C by over a point. And in that time, they also reduced their depression by 50%. So they're really achieving both the outcomes for the diabetes and the depression. And these are the kinds of things that, that's why I get up every day. So yeah. It really makes it's great to see the outcomes.
I love the promotion story because it really does show how subtly but profoundly interconnected our mental health is with our job performance, with our quality of life, with our happiness. And sometimes, we just need to look inside and take care of ourselves before we're able to measure up to our full potential. And there are few things as gratifying as seeing people measure up to their potential. But what about Vida has relatively recently, the last few months, been expanding into a Medicare population. And this is a group that is different from the employers, the employees of our employer clients, because these are folks who just in many cases they've slipped through the cracks of our healthcare system. They live in food deserts. They don't have access to care. They're the embodiment of many of the things that you have pointed out as challenges with our healthcare system. Talk about what Vida is doing there and what you're seeing in terms of outcomes.
It's been fascinating. So when we look at the Medicare population, they have a high co-occurring level of diabetes plus depression. And, many of them, when in their generation, they weren't open to therapy. That wasn't something that they thought that they should be doing. So, but what we've done is we've partnered with them. They come in, we'll enroll them, let's say, in the diabetes management program, and then the RD or CDE will work with them. And if they need therapy, we'll enroll them in therapy, and we're getting them into a place where they're actually managing their diabetes and depression. And we're solving for some of the harder issues like loneliness. We built a loneliness program. We've trained our coaches and therapists and RDs and CDEs around this matter. We've created social groups and put them together. So we've really, and then for the food desert issue and the social determinants of health, we've partnered with our Medicare plan partner, and we've actually looked at the services that they offer and made sure we refer people to those services. And we've built content and information around social determinants to try to get at these issues. It's harder to manage with individuals that have a confluence of, multiple conditions, social determinants, and especially during this time. But I'm really proud of the work we're doing there. We've seen really high engagement and amazing outcomes and amazing cost savings, actually. So it's been very rewarding to help this population.
Yeah. Well, we have just a few minutes left, Stephanie. So I'm going to enter into what I'll call the lightning round. I'm just going to ask you, there's a few questions that I would love to do a deep dive into, and we just don't have time to, but I want to touch on these things. So I'm going to ask you questions and just try to answer as quickly as you can, just 2 or 3 of them. The first one is, you started the company with your dad in mind and your experience there at a time when, and you come from a tech background where most companies are very, very focused on solving one problem, going deep really well. But you've talked about diabetes, depression, anxiety, smoking cessation, all kinds of other things. Why did you choose to go broad rather than narrow when you built the company?
Well, we started with cardiometabolic syndrome and then added depression and anxiety. So we were very deliberate in looking at the highest, the disease conditions that overlap the most and where they were the highest cost drivers in the country. But we built it as a platform from the ground up with a polychronic approach, because we knew that people are human and they have multiple conditions and they don't want to have 5 different apps for 5 different conditions. I also have a background in tech where I have built platforms and products that have scaled to millions of users. So I think in that way. So it was like a natural way of approaching the problem for me and the team. And but we did start with cardiometabolic syndrome, then went to mental health, and then expanded from there.
Okay, got it. That's helpful. Thank you. So you talked about how when you were at Google, so many aspects of your life were on your phone. They were apps, they were technology driven, but there was very little in healthcare that was. Talk about the balance of AI and technology and humans, because you also talked about therapeutic alliance. So how do you see those two balancing?
Yeah, I mean, I listen, we use machine learning throughout our product. We use AI and machine learning, and we want to do more of that. But you have to have a human in healthcare to really get the outcomes right now. Maybe it changes a decade from now, but the human connection and that accountability and that conversation is vital. It's really hard to really connect with someone and get to the root drivers of their condition and their issues without having a human touch. I don't see that changing anytime soon. I do see machine learning helping us enable our providers to practice at the top of their license. And that's really how we use machine learning and AI, is we have a platform where we get insights, we get information, and we enable our providers to practice at the top of their license.
And that can help close that supply and demand gap that we talked about earlier.
Yes, absolutely.
All right. Well, that's all the time we have. Thank you so much, Stephanie. And thank you to everybody for attending our session. And we look forward to working together to change the way that we take care of Americans throughout this country and eventually the world, and really take care of mental health so that we can all operate at the top of our game and be happiest as a society and as individuals. Thank you, Stephanie.
Absolutely. Thank you, Kevin.